Good morning, everyone, and welcome to today's episode of We're All Patients. We're digging into a big question. What does it really take to improve rural healthcare in America? To help us break that down, I'm thrilled to be joined by Rich Sutphin, Executive Director of the West Virginia Rural Health Association. Rich is a seasoned nonprofit leader with deep experience in grant writing, fundraising, and program implementation. He's worked across academic medical centers, community hospitals, and federally qualified health centers. And he's developed a sharp focus on health policy, healthcare access, and improving outcomes for rural and aging populations. Rich, it's great to have you here. Thanks for joining.
Yeah, thanks for having me, Sam.
So, I'm very curious of all things that you could be doing, you're obviously working with rural healthcare. What do you love about working with rural health?
Yeah, so to answer that question, I'd like to give a little bit of my background. I grew up in the southern coal fields of West Virginia in Boone County. I often say that I grew up in a holler, at the mouth of another holler, in another holler. So very far from a lot of access to different services. And so growing up in that environment, I realized that rural people are tenacious, and we hear that all the time. And sometimes it's a trope that we're bootstrap people and we can pull ourselves up from the bootstraps and go on. But so growing up there, we had a fictive kin aunt who lived up the road from us, and she was a very fiery person who lived to be almost 100. And so learning from her about ways to take care of yourself and to really serve the community around you were really important lessons. And so I often say, my why is partially where I grew up. And then going forward, how can I make my state and my community better? I did some work in my undergraduate years in East Africa, and so coming back from Tanzania, I'm like, well, why would I go somewhere else whenever we're facing similar issues here in West Virginia and Appalachia, and I can make a bigger impact here within our communities? And so the reason I love working with rural health, though, is we have a lot of great people who are in it for the mission and the people. Um, Generally, when you walk into a rural hospital in West Virginia, everyone from the CEO to environmental services, they're all about their community and they're all about serving their people. It's not about a bottom line. It's not about, you know, somebody getting a bonus. It's about making sure that our neighbors and our friends and our family receive the best health care as possible.
Wow, so yeah, it sounds like people got each other's backs and really focus on serving their communities and their neighbors above all else.
Hmm. Absolutely.
So, with that, I'm very curious about uh, what's been going on, kind of what you've been involved in to help expand patients' access to care in the communities in West Virginia.
Yeah. So one of the things that we do, we host a conference every year, and so we bring a lot of folks from West Virginia and the region together to discuss ideas, and so figuring out exactly how we can increase access to care. So we do a lot of workforce development. We work closely with our academic medical centers and our AHEC program in West Virginia to really enforce and reinforce the idea that rural is a great place to work and live. And so we are excited to be able to work with those folks because we can see students from high school through the pipeline into residency if they're going the medical path or into a nursing career, and really making that difference of showing folks that you don't have to go. And our joke in West Virginia is that our largest export is Charlotte, is brain talent to Charlotte. You don't have to go to Charlotte or Nashville or Columbus to live a great life and to be able to provide great services and do research and do all those types of things you can still do in rural communities. So that's one way that we're working on that. And the other way, we're trying to work with different entities to create new models of care. So something that we started in 2020 is a unique model to treat hepatitis in community settings. And so through that model, we've been able to train almost 400 folks to treat hepatitis, and we've reached over 2,100 patients for treating hepatitis C. And out of that came a program called the HIV Academic Mentoring Partnership and Obstructive Sleep Apnea. So as we're learning more about what communities need in West Virginia, we have a lot of substance use disorder, and along with that comes the other diseases, right? Hepatitis, HIV are two of the big ones. And so we have a lot of disease burden. So we created those programs. And then we learned that, we had a pulmonologist in Morgantown who was really interested in rural health and community health. And so we learned that a lot of folks are delaying care or don't have access to care for obstructive sleep apnea because they don't live close enough to a center that can provide the test and don't have access to a provider who can interpret the test and create a care plan. And so through those models, we're able to really get that academic, big hospital knowledge out to our smaller communities. So folks can receive care from a health system that they trust, from their provider that they trust, without having to travel a few hours to the next largest city.
Wow. So it sounds like you started off with hepatitis, and then from there you expanded into HIV care as well as obstructive sleep apnea. So HIV, I can see how it's kind of in the same general vicinity of like hepatitis. How did obstructive sleep apnea? Because I guess so. How did that come about? Like, was that from you were treating the patients with HCV and HIV, and then you saw that they had sleep apnea, or because that's a totally different condition?
No, yeah. So we identified that this model could work, and it started out as a pilot. Will this model work in other disease states? And so what we decided was we had a pulmonologist who was really interested in doing outreach and service in rural communities. And so we worked together with him to say, this would probably work with obstructive sleep apnea. Can we pilot it? And so as we've seen folks enroll in this program, the providers are really satisfied because they're learning how to provide this care to patients. In West Virginia, we have a high burden of obesity, diabetes, heart disease. And so all of those are factors that could be caused by sleep apnea or could cause sleep apnea in the obesity side of things. And so what we saw was that there are a lot of patients who are going untreated for that because they didn't have the access to the care, or they would get an appointment with a pulmonologist, but it would be 6 months or 9 months out, and then it would be rescheduled a couple of times because, at that point, hospital service and all of those different nuanced factors that come into managing a clinic would come up, and so patients would just get dissatisfied with that. And so, by creating a way for their primary care provider to understand and treat the disease, has helped to get that care to the rural communities, and so. The way the program's set up, we do a training, a half-day training, and then there's a bi-directional communication line. So providers can ask questions and do kind of a curbside consultation. And then they're provided with, this is the study. You need to do this study. And then once that study is completed, a pulmonologist at one of our academic centers interprets that study and helps to develop that care plan. So it was kind of one of those things of, we know we have a lot of OSA in West Virginia. How do we approach this so that we don't require folks who live 2 hours from Charleston or Morgantown or Parkersburg to get that care that they need?
Wow. So this seems like a pretty proactive program in terms of the patients are getting the care that they need without having to worry about hours or without having to worry about how they're going to be able to plan travel and for care that's a few hours away. And also this sounds like a great way of keeping them out of the hospital as well. Which helps them keep their quality of life and not have to. It works from a lot of different perspectives. But have you seen what kind of downstream effects have you seen from this program?
So especially with our hepatitis and HIV programs, a lot of these folks are entering recovery. And so as they're entering recovery, one of the last things that they have to deal with is these chronic illnesses, especially with hepatitis. It's curable. 8 weeks or 12 weeks, you can cure hepatitis generally. We have some treatment-resistant strains, and we have some folks that have co-infections with other types of hepatitis, or they have HIV at the same time. But generally, once somebody has entered recovery and they get cured by a provider, and especially someone who they trust, whether it's their addiction medicine provider who runs the MAT clinic or their primary care provider, that's a really big milestone for them. And it really helps to fuel that recovery journey because that's the last step really to entering long-term recovery for a lot of folks. And so as we're looking at the way that this program works, we not only are providing our primary care providers and addiction medicine folks with the opportunity to cure a disease, which is really satisfying because in primary care, you manage diabetes, you manage hypertension, you manage all of these other disease states that primary care deals with, but you can cure hepatitis. And so that's really rewarding for our providers. And on the same side, they're seeing these patients that are really satisfied with their care. And the same thing with HIV is there's a lot of folks who would be hesitant to be tested for HIV at a health department or at a clinic they don't know, but they have built this relationship with their primary care provider, and so they can be honest with the primary care provider and say, this is a concern. I have high-risk behaviors. You know that I have high-risk behaviors. I want to be screened, and then once, if it's positive, they can receive that treatment from that provider instead of having to go to a system that they don't know, to a provider they don't know, and get kind of into this unknown space where there are a lot of uncertainties around what type of treatment I'm going to receive, what type of stigma I'm going to face as I enter a new system.
So it sounds like it's been pretty productive for both sides, on the clinical side and on the patient side, because on the clinical side, it helps the docs feel that they are making a difference and they can see the improved health in their, especially for hepatitis in their population. So it's nice because otherwise it can be really disheartening after a while if you're, if there's no improvement or you just keep seeing people who, whether it's because of access to care or no other options, etc., that it's like the doctors are trying, but really they really don't see much improvement in from their efforts. So it's kind of cool that
Right.
this program helps them kind of see that accomplishment. Let's jump to another topic where this has been on my mind a lot. I'm sure it's been on your mind a lot. That's the recent passing of the Big Beautiful Bill, and then the associated kind of topic that comes along with it, which is the Rural Health Transformation Fund. Can you talk about a little bit about that, like kind of what it is and what that means for you guys?
Yeah. So House Resolution 1, when it was signed into law in July 4th of this year, it became the law of the land. A lot of folks in rural health and in healthcare in general didn't want to see that bill passed, right? It creates a lot of changes and rules around Medicaid. So West Virginia, throughout that the next 5 years, is expected to lose about $6 billion from our healthcare system. So how do we make that up? And so Congress created the $50 billion Rural Health Transformation Fund. So 50% of those funds, $25 billion over 5 years, is supposed to be distributed equally among states that have an approved application with CMS. So the applications are due and have to be approved by December 31st of this year. We're still waiting for the application guidelines. And so each governor's office is creating a new process to deal with. We're receiving $100 million a year over the next 5 years. How do we spend that $500 million to make sure that we're transforming our healthcare system to be able to kind of absorb the shock of these huge cuts that we're expecting? So along with that, so that's the required in statute how to distribute these funds. There's another 50%, so another $25 billion that the statute says that CMS has wide discretion on how to utilize these funds. So we're expecting that they'll create a formula based on various factors, virality, need, those types of factors. And so that could create another pot of money that would come to states. Um, the statute only requires it to be distributed to at least 25% of the states. So that's, about 13 states are required to receive funding under that second discretionary pot of money. So some states may receive a lot more money in the second round. Some may receive none. That's to be seen. So with this Rural Health Transformation Fund, it's really prescriptive. It can't be used to replace federal Medicaid dollars. It can be used for recruitment and retention in certain instances. So as we're looking at workforce development, if the state were to create a plan that involved recruiting and retaining providers for at least 5 years, some of those dollars could be spent managing that program. Overall, I'm optimistic that our state, West Virginia in particular, is going to do a good job of creating a plan that's thoughtful, that engages all of our stakeholders, and helps to really move the needle on how do we transform the way we deliver care. Do we need more resources in our infrastructure so we can provide better telehealth services? Do we need better education? Absolutely, we need better education with providers on how to utilize telehealth, remote patient monitoring, those types of technology, to ensure that they can provide this level of care that folks in rural communities need. Can we expand our hub and spoke models that we have with our big health systems that have telehealth services? Could we, continue to utilize the rules that are in place to allow RHCs and FQHCs to be originating sites? So each state has really complex issues around healthcare and around Medicaid enrollment and spending. So each state's going to be completely different. And so I always say that if you've seen one rural community, you've seen one rural community. If you've seen one state, you've seen one state. In West Virginia, that's really true because, we have 5 or 6 areas that are highly populated, and the rest of the state is really rural. And so our largest city is 50,000 people. So, in that MSA, there's, a third of the people that live in one of our large cities throughout the U.S. So, which that spans 4 counties. So we're seeing that our state is really able to coalesce around this idea that we know the cuts are coming. Now is not the time to panic. But now is the time to plan. How do we utilize this $500 million that we're getting over the next 5 years to make sure all West Virginians can continue to receive high quality care close to home, and can receive the best services possible, whether that's through telehealth or creating alternative ways of receiving care.
Well, I mean, it sounds like you guys have been giving it a lot of thought. So it's telehealth, increasing hub and spoke relationships. So I guess with that, what would be what are the things most at risk of being cut or reduced um, with these Medicaid cuts?
Yeah, so obviously number one on everyone's list was hospital closures as the discussion and debate around this. So the UNC SHIP Center published a list of 7 hospitals in West Virginia that were at risk of closure based on the provisions in House Resolution 1. So the 6 of those hospitals are within the top 10% of Medicaid providers nationwide. And then the 7th one had been operating on a negative margin for at least 3 years. So hospital closure is a real risk with these changes. With that, if any of our health systems lose funding, there's going to be cuts to services, right? So will they continue to provide services that they're operating at a loss? Or will they be able to continue to staff all of the beds in the hospital? Will they be able to continue their community outreach and community engagement? What types of services do they provide to the community that will have to go away because they no longer have the operating margin to sustain that? So I think, within the large realm of things, the worst that could happen is a hospital close. What will absolutely happen is that hospitals will have to figure out how to change the way they're providing care or cut services. And so what we'll see is a decreased access to specific services within our rural communities and within our state as a whole. West Virginia has a really high government payer mix. So we have one of the highest in the nation. We only have about 21% that are covered by a commercial plan. And so as we're looking at these cuts, we're going to see a lot of folks who have no access to care, whether it's an inability to meet the work requirements or to navigate the system to re-enroll every 6 months, or if it's due to the cuts that we're expecting with the provider taxes and state directed payments. So all of these coming together are really a bad storm for West Virginia as we're looking at healthcare financing in general. And with that, as we see more folks, and we also know that insurance coverage doesn't dictate when someone goes to the hospital, to the emergency department. So as we see more uncompensated care come into our state, there's going to be, again, decreases to services, maybe staff layoffs, those types of conversations that are business decisions that are going to happen at the local level. We're going to see a lot of that.
So with all this, with hospitals trying to figure out how they're going to survive given the new environment and the new cuts, currently, up until now, what are some ways that hospitals have stepped up beyond their traditional roles? Like, what are some success stories with, what you've been proud to see happen?
Yeah, so a lot of our rural hospitals are the hub, right? So we know that hospitals in rural communities are the largest employer. Maybe, if a community has a Walmart, they may have a few more staff. But economically, they're really economic drivers. They have large staffs that are paid high wages compared to other industries in those communities. So that's one, right? So they're providing this economic development, and it's two factors, right? So not only are they supplying a lot of jobs, but as folks are looking to expand businesses or come to a new area, a business that wants to come to a community is more likely to come to a community that has a hospital, that has a healthcare system that can provide care for their employees and their staff than a community that doesn't have a hospital. The other things that a lot of our hospitals in West Virginia do, they're involved in a lot of different things, right? So each year or every 3 years, they do a community health needs assessment, right? All nonprofit hospitals are required to do that. But in West Virginia, generally, they take a really deliberative approach to understanding the true needs within a community. So out of those comes, we have a critical access hospital that manages the county's emergency ambulance services. We have another critical access hospital that has a non-emergent medical transport operation. We have rural hospitals and rural FQHCs that are the only fitness facility within a large radius. We have community health centers and small hospitals that provide the senior lunch program within West Virginia. We have community hospitals that run long-term care facilities outside of their critical access hospital footprint. That happens a lot in West Virginia. We see a lot of folks that are a lot of our small community hospitals that are involved in their communities so deeply. We have one community hospital in Southern West Virginia that's opening a farmer's market, the first farmer's market in that county it has a teaching kitchen and all of these different things that are really going to help address the social determinants of health. So we're seeing all of these really creative ways to provide the care that folks need in their community coming to fruition. And as we're looking at these cuts through the House Resolution 1, a lot of those services could go away. Especially if a hospital closes and they operate a skilled nursing facility and they operate 3 rural health clinics and they operate the emergency ambulance service, what's going to happen in that community? Who's going to pick up those pieces? The county can't afford to bring on the emergency ambulance service as it is. So it may go back to you have 4 paramedics in the entire county with 1 ambulance. So 2 shifts, 2 12-hour shifts, which is not ideal in rural communities, especially as we know that, emergencies typically happen in rural communities. If you have a car accident in a place that's 2 hours from a hospital that can be treated, where you can be treated, and it takes 30 minutes for the ambulance to get there, if they're even in the county, then there's going to be a lot more negative impacts than if somebody were to have access to care within that golden hour. There's a lot of different things that our rural hospitals are doing to really move the needle on providing good care for their communities. And again, it comes back to where I started, that these hospitals, the folks that are working in these hospitals, are really laser focused on what can we do for our community.
So with that, actually, so from your perspective, out of curiosity, what are the top most urgent concerns that hospitals in West Virginia have that they wish, if they had a magic wand, there was a solution for?
Yeah, so I think one of them, obviously, every time you talk about rural healthcare, if you talk to somebody about rural health and they don't mention transportation, they probably haven't worked in rural health very long. That's one. So being able to get patients safely to their appointments and to their treatments is really important, especially as we're looking at the space of, we have a lot of chronic kidney disease. So how do we get folks from their homes to a dialysis center, or how do we create programs and policies that benefit at-home treatment, home dialysis. So that's one aspect. Transportation is always going to be at the top of the list. As we're looking at other things that are really important, food instability is huge in West Virginia. We have a lot of food deserts, and so we have a really large movement within our state to look at food as medicine, and how do we ensure that folks have access to food that is healthy and as fresh as possible. So we have a lot of our community-based facilities that are providing food boxes, medically indicated food boxes. They're working with our food banks to ensure that veterans have access to food. They're working with our payers, the Medicaid managed care organizations, to ensure that their members are able to receive these foods, because we know that A, groceries are expensive, and B, a lot of our places don't. We have a county in West Virginia that doesn't even have a grocery store. So where are these folks getting their food? It's probably the Dollar General, which is generally super processed foods and are what we would call unhealthy. So if folks don't have access to healthy food, they're not going to eat healthy food. And we also know as a society that if you're eating unhealthy food, then you have a lot more risk of developing diseases, obesity, diabetes, hypertension, heart disease. All of those factors can be traced back to food as one of the factors. I think the other areas that are really on the top of the radar for rural hospitals is recruitment. It's really difficult to recruit providers. We're looking at healthcare shortages nationwide due to provider loss. So within the next 10 years, we're going to be hundreds of thousands of physician and nurses we're going to have a shortage of hundreds of thousands of nurses and providers. So how do we ensure that folks want to move to a community and want to work in a community? And a lot of times what our communities see is that they have to grow their own. So they have to invest in students that are graduating high school and say, we're going to help you pay for college if you'll come back and work for us. Or they make sure that They participate in programs to recruit and retain providers like the State Loan Repayment Program, the National Health Service Corps. We have a lot of folks who participate in those programs. Another program that we utilize for workforce development is the J-1 Visa Waiver Program. West Virginia generally every year utilizes all of our 30 spots through the Conrad program. And then we also get additional spots from the Appalachian Regional Commission. And so on average, we have about 36 folks who are internationally trained who come to West Virginia to practice, and something that has been kind of studied through one of our academic institutions is how many of these folks stay once they complete their training, once they complete their service period, how many are staying, and it's really actually a lot. So we have a high percentage of retention to the state and a high percentage of retention within those communities where folks go to work. So folks who come on on the visa waiver program, they have to work in a health profession shortage area. And so 53 of our 55 counties are health profession shortage areas. So pretty much they could throw a dart and work in any of the communities in West Virginia. So we've had really good successes with that. So I would say transportation, food, and workforce are the three top issues in West Virginia.
Yeah, the hospital where I did my internal medicine residency was on the west side of Columbus, and I think it's like one of the it's such a food and nutrition desert that it's it's a case study for essentially there's been case studies done on how bad of a food desert it is, Hilltop neighborhood in Columbus, and even though it's an urban neighborhood, right, it still essentially faces a lot of the issues that rural communities face with just yeah, so that hits home because I've seen that firsthand, and when there's no essentially healthy place to get food from, or especially education wise, people don't even know that the food necessarily is unhealthy or what healthy even looks like. That's interesting that you mentioned programs that help educate people about healthy food, provide food boxes, medically indicated food boxes.
And I
Seems
will
like
say that these
yeah,
programs are becoming even more important as we're looking at cuts to SNAP and reforms with that. So our extension service does a really great job with our SNAP Ed program, teaching kids. We have a program called Try This, where they take foods that aren't normally on a child's plate into the schools and say, try this food. You might like it. And then out of that, grew a program called Grow This West Virginia, which started during the COVID pandemic, where folks were at home and they were planting gardens, and folks who had never grown a vegetable before were growing vegetables. So they give out 3 different packets of seeds every year to get folks engaged in, you can provide for yourself, and here are healthy ways to grow these vegetables and healthy ways to utilize them once they're grown. So a little anecdote, my son is now 3, but he was 2.5. We were at the Easter celebration at the West Virginia Capitol, and the SNAP Ed program was set up there, and we got seeds for cucumbers, and we grew cucumbers, and he was so excited when he got his first cucumber. And so that happens at all the levels, right? Like you put this seed in the ground, and you wait and wait, and you water, and eventually you see a little bit of greenery, and then eventually get your own cucumber. And so like folks find that really rewarding. But as we're looking at reforms to SNAP, those programs are going to be the first ones that get cut.
wow. And those are probably some of the more productive or useful programs too.
Absolutely.
So, are there ways that the revenue from the revenue that when the money that would come from SNAP and from Medicaid, etc., are there ways to make up for that revenue at all? Like in terms of kind of create new revenue, or like for hospitals, for instance, to have new revenue streams, things like that.
Yeah, so often when we talk about that, we look for different funding sources. So a lot of times it's the insurance companies, the Medicaid managed care organizations that are really investing a lot of dollars in this space. But as we're looking at, if provider taxes and state directed payments go away, then they're going to be potentially looking at how do we cut costs on our side. And so I think generally our insurance companies in West Virginia have realized that this investment helps save dollars down the line, right? That providing these services and investing in healthy foods is really decreasing the burden of other diseases and helping to keep their patient population healthy. I think if you look at philanthropy, we often hear that, oh, well, philanthropy is going to step up in these cases. Well, philanthropy is not going to be able to supplant the federal funding that's going into these programs. They may be able to help in a specific instance, but generally at a statewide level, there's no philanthropic organization, aside from a few really, really large ones, that are going to be able to come in and say, we're going to supplant the funding that you lost from the federal government. Um, so I think generally it's going to take some real creativity on the ground to figure out how to continue these programs and make sure that folks still have access to healthy foods.
Yeah, because to your point earlier, when you mentioned instead of you for example with provider retention, staff retention, to avoid losing people to other cities and states, um, it helps to have a strong hospital or primary care for it, and then with that comes economic opportunity, economic development, and more companies, more jobs, and it kind of it's a great positive cycle, or like a virtuous cycle when, well, you have a healthy healthcare uh, facility or community, and that helps drive economic development, which then attracts more people, which then helps the hospital and the providers in the area do better, and it kind of feeds on itself, and kind of everyone benefits. Versus if they're able, if on the other hand, if the hospitals are forced to cut services, then that obviously kind of has the opposite effect. Um, and Yeah, that's a lot of money for philanthropists or people like that to be able to make up, right? I mean, that's we're not talking about thousands of dollars or you know even hundreds of thousands of dollars. These are millions, tens of millions of dollars, and hundreds of millions of dollars every year.
Right.
Um, so yeah, I'm curious to see how hospitals handle that, and um, curious in a way that I hope that they're able to um, create opportunities in the in the face of, let's say, chaos.
Right. Yeah, and as I said, we have a hospital that's opening in this farmers market to create a healthy eating space for folks, and kind of create it as a place where folks can gather, and having the teaching kitchen can say, hey, here's a new vegetable that you've probably never seen or never eaten. This is how you can cook it, and this is what it's going to taste like. And so I think also showing folks that you don't have to cook the way that your parents and grandparents did to get the same flavor, right? And so you don't have to use, partially hydrogenated vegetable oils or
Right.
Crisco's, or you don't have to use lard to make food that tastes good. And so I think shifting that paradigm, like folks in Appalachia love to eat, and folks in the South generally love deep fried foods. But how can we move beyond those types of foods to ensure that folks have access to care and access to foods that are going to decrease their need for specific services? And so I think generally our communities are going to step up and help take care of each other, right? Obviously, it's kind of a common theme in what I say always. But as we're looking at coming back to the economic hospitals and economic driver, if we have these hospitals that are cutting services, losing staff, potentially closing, the other system that's going to be really negatively impacted is our education system, because those are typically funded through local taxes and state taxes. And so if our state and local communities are taking in fewer tax dollars, those are going to be cuts, right? And so how do you recruit and retain a provider who is highly educated, likely has a highly educated significant other spouse, and has children that they want to have a really good education system for? If we have cuts at the hospital level, we're going to see cuts in the education system, and the quality of education is going to go down. So again, instead of having this great cycle that is kind of self-sustaining, positive system, you're going to have this vicious cycle where the community really loses not only their economic driver, but they lose all of the education, all these other services that county taxes would fund. So, in West Virginia, that's just going to be detrimental to all of our little communities.
So the people watching this and we're listening to our conversation, is there anything that the everyday person can do to ensure that the rural communities thrive?
Yeah, I think getting involved in your community is always really important. Reaching out to a hospital to say, I want to come and volunteer. There are a lot of services that volunteers provide in our small hospitals that would go unnoticed, but are essential. Whether it's sitting with a patient whose family needs some respite care, or making sure that the mail is delivered to the right unit, is really rewarding for folks. I think also, as a person who is a self-proclaimed policy wonk, making sure you stay involved with your delegation, whether it's at the federal or state level, making sure you're involved and making sure that your voice is heard. A lot of times folks feel like their voice doesn't matter. It's drowned out by media or drowned out by, different social factors that exist in the U.S. or within a specific state. But making sure that your elected officials know this is where you stand and this is how you feel, and making sure that they're aware of the benefits of these programs, that they're not just dollars on a spreadsheet, that these are real dollars that are impacting real lives. I think that's really, really important, because as we move as a society away from civic engagement, we're just going to continue to see erosion of our government, right? And so as we look at ways to stay involved, making sure you reach out to folks, even if it's one email or one phone call to your elected officials that say that, and you get 3 other people to do that, that's 4 emails or 4 phone calls. So as you do this grassroots type of advocacy, eventually folks are going to listen. And if you come in and say, I represent, or I work with a hospital that employs 400 people in your community, and the cuts that you're talking about implementing are going to impact these the 400 folks that live here and work here, but also the other 1,000 people that live in this community. So I think that is really, really important. I think also always just staying abreast of and understanding the different programs that exist in rural communities for healthcare. I think, a lot of times our older folks in our community may not know about a new service, or folks who are busy working, 60 hours a week or 3 jobs, are too busy to know about a new program that can really support them. So being kind of an information referral, making sure that folks, if you see somebody who has a need, make sure that you get them connected to the hospital that provides that service, or make sure you connect them to the community-based organization that's serving that type of need. We have to look out for each other, right? So especially as these cuts are pending and looming, we're looking at how can you as a citizen help take care of your neighbor?
So it sounds like there's a lot of things that people can do to really become active in the community, become active as far as advocacy goes, and really bring more attention from the local government, from the state government, from the federal government to what they're dealing with, and make sure that their voices are heard.
Right. So one of the programs we have in West Virginia it's called Wild, Wonderful, Healthy West Virginia. It's run by our health-focused community development financial institution. And so part of that is one of the counties has a dilapidated housing problem. And so the Wild, Wonderful, Healthy West Virginia group in that county has really worked with the county commission. They go to every meeting. They say, make sure that their voice is heard to get these dilapidated buildings taken care of, that trying to deal with blight in their very small town. So I think that's really important too, of like, when I first started in this role, I was told by a consultant, whether or not you're at the table, you're still being served. So making sure you're at the table as you're being served, you can say, no, I don't like broccoli. Please don't serve that to me. I don't like this policy. Please don't serve it to my community is really important. So making sure you're at the table is key to that. And so showing up to a few county commission meetings or a few city council meetings can go a long way in making sure that that your needs are met from the government.
I love that phrase. Whether or not you're at the table, you're still being served.
Yeah.
I'm gonna steal that if you don't mind. If you don't mind, that's awesome. Um, so, last question for you. I think West Virginia seems like it's one of the best kept secrets of all the states in terms of. I know that you guys are it's a wild, wonderful state, but it seems like not many people actually know that it is the wild, wonderful state. Um, what's your favorite part about the nature in West Virginia? I
Yeah.
know I'm
So
asking you to break your secrecy, but
Yeah, so I love that West Virginia has 4 seasons, right? So in our mountain season, mountain area during the winter season, we have really good skiing and really high adrenaline type things there during the winter. During the summer, we have whitewater rafting, which is absolutely awesome. And then towards the end of summer, we have the Gauley season, so the Gauley River. On the Gauley River, we have Summersville Lake. And so it's a Army Corps of Engineers lake. And so as they start draining down to Winter Pool, there's a few weeks where there's really, really world-class whitewater rafting on the Gauley River. And then in the spring and fall, rock climbing is really big in West Virginia. So there are a ton of places to do that. Mountain biking is huge. I think I love West Virginia because no matter what level, so I just talked about a lot of high adrenaline type things that happen in West Virginia, but it's also one of those places where you can really be quiet and just see nature. So we have a lot of really historical places that are really cool to visit, like Harper's Ferry is really nice. It's a National Park Service run area, so you can see John Brown's Fort and really understand the history of West Virginia. Um, West Virginia is really steeped in a lot of different history. So another thing that I always recommend for folks if they're in the Charleston area is to stop at our state's museum at the Culture Center on the grounds of our Capitol. It is a absolutely gorgeous museum, and it's free to enter. So come and learn about West Virginia's history. We have a lot of different history. Another thing that we have in our historical past is a lot of industries in West Virginia that don't exist anymore. So we have glass blowing. At one point in time, we had 450 glass factories in West Virginia, and now we're down to just a couple. So if you're ever in the Milton area, seeing Blenko glass is really cool. They do tours and they show you how products are made in a way that hasn't changed in years, in decades, probably close to centuries in our state. So I think it's just really important for folks to understand we're not just a drive-through state. A lot of folks use our turnpike to get from north to south, but take some time to stop in those areas. Along the turnpike, there's a lot of opportunities. So Tamarack is our state's artisan shop right off the exit. There's all kinds of services right there. So whether you're just driving through and want to see something unique about West Virginia, you can do that. Or if you want to come and stay and take some time to understand our culture and our people, there's plenty of opportunities to do that. And if you want a really quiet place, the final thing I'll say about West Virginia is we're right in the middle of the National Radio Quiet Zone because we have the Green Bank Observatory, which is a really phenomenal experience if you're into astronomy and technology. Those folks that are in the STEM field would love Green Bank Observatory just because it's a radio telescope that is doing really cool things. But within that area, it is the radio quiet zone. So it's a place where your cell phone doesn't work. If you want to really disconnect from the chatter of making sure you're checking emails or checking text messages, Pocahontas County and that area is really, really cool for that. And in that area, we have Cass Scenic Railroad, which is an old mining town that has a railroad that goes up the mountain. And so there's just a lot of really cool experiences here in West Virginia.
Wow. So I'll be honest, I didn't even know that a national radio quiet zone was even a thing. So that is really cool because I actually got into astronomy a while back. So that sounds like a really cool place to visit. So I appreciate that.
Yeah. Yeah, and within that, so there's a state park that's close by that's a certified dark area. So the stars you can really see really, really well from there. So Watoga State Park is a great place to visit. They have campgrounds, they have cabins, and you can see absolutely gorgeous stars at night, and it's just really, really cool.
I'm just making note of that. I'm always looking for cool places to go. Um, and from Ohio, from Columbus, especially West Virginia, is a very short drive. So,
Yeah.
well, very cool. Rich, thank you so much for talking with me. This has been very enlightening. We've covered a lot of topics, and uh, I'm not sure what you're a bigger expert on, rural health or the tourist attractions in West Virginia. So, um,
Uh, I guess those are two areas of expertise. So,
that's awesome. I love it. Cool. Well, yeah, thank you so much. And thank you, everyone, for joining us and participating in the conversation. We'll end here.